Welcome to 12 to Your Health. I'm Dr. Derek Da Silva. Last week we talked about how the wrong golf technique can lead to serious injuries. This week we're going to show you the right way and the best way to make the correct golf swing. Joining us once again is Dr. Dante Implicito, who's the Chief of Spine Surgery at Hackensack University Medical Center. Thanks so much once again for being here.
Thanks for having me back.
What are some of the problems with the wrong golf swing? How can it affect our bodies?
Well, injuries. Injuries to your low back, injuries to your shoulders, your wrists, your elbows. Bad balance, bad swing leads to trips to the doctor's office.
So what's the right way to swing? What's the right golf swing?
Okay. Well, I'll try and demonstrate for you in my pathetic swing of my own.
Just watch the monitor.
Yeah, so watch the monitor. So,
okay.
So the modern golf swing has evolved. Previously, we were taught when I was growing up to stand over the ball like this, and as you take the club back, to keep your head perfectly still and sort of tilt with your hands coming up vertically, and then swing to come back like this, and finishing with a big hyperextension back here of the spine called the reverse C. Mm-hmm. The more modern golf swing has you turning, rotating, bringing your hands up like this, and then coming down through and finishing centered over the ball with no hyperextension, which really minimizes the chance of injury to your low back and to your shoulders.
So is that the biggest issue that you see, is the spine and back issues?
Yes, for me personally, that's my whole practice, but I would say the shoulder guys are just as busy as the spine guys are.
When you talk to people about this, what is the one bit of advice that you really give them?
I would say flexibility, and to get proper instruction from a PGA professional that can really help you not only learn the correct swing, but if you're older and you have some other orthopedic injuries, can teach you the workaround so you don't get hurt.
You know, one of the things you just said really triggered something in my mind. Golf is one of those sports where very few times I see people stretching.
Yes.
How critical is that?
Very, very, very critical. Not only 5 minutes before you hit your first ball, but really on a daily basis. I preach flexibility, 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 particularly in the aging athlete who wants to play up into his 60s and 70s.
If you had to give us one good flexibility, one good stretching exercise for your back, what would it be? What do you like?
I like the lying flat on your back and pulling your knee to your opposite shoulder and twisting your body like this, and then working on your hamstrings as well. Both very, very important for your low back.
Hamstrings, critical in most sports that people don't pay a lot of attention to.
That's right, that's right.
Thank you so much, great advice.
Thanks for having me.
Thank you very much for being here. Folks, and here's a look at what's coming up tomorrow. And remember, once again, you can catch 12 to Your Health every Saturday and Sunday at 15 minutes past the hour, starting at 6 a.m. Well, it's time now for our health bite of the week. A little bit of caffeine may give you just the boost you need, but how much is too much? Experts recommend no more than 200 to 300 micrograms a day. That's about 2 to 4 cups of brewed coffee. More than that can lead to insomnia, restlessness, rapid heartbeat, and muscle tremors. Well, once again, I'm tackling one of your common health questions. Can the effects of smoking be reversed after kicking the habit? Absolutely, unequivocally, yes. It is never too late to develop good habits. And if you have any health questions you'd like to ask me, email them to me at 12toyourhealth@news12.com. Once again, thank you so much for joining us today, and here's a look at this week's Community Health Calendar.